Hi, I'm Sherrie Palm, coming to you from the U.S. I'm the founder and CEO of APOPS, the Association for Pelvic Organ Prolapse Support. I'd like to extend a warm welcome to all of the AIUG attendees, and I'd like to share a little bit of information with you all about what APOPS is and what we do. I founded APOPS in 2010 with the intention of radically shifting the pelvic organ prolapse dynamic. 4,000 years of medical documentation still stuffed in the closet is ridiculous. And what has occurred over the years since founding has been like a tsunami wave building slowly over time. We have got patient following mid-teens through end of life in 177 countries in our space now. And that's patient and practitioner both. And the bottom line is there's a significant evolution of and revolution in women's wellness that is in play now. This is not women's health alone. This is a movement. And it's imperative that those like you attendees that address this most significant health issue are really paying attention to the energy that's occurring now. There's a big shift coming that'll impact awareness, screening, practice, and policy. I urge you all to pay close attention. What we see in here in our space all day, every day, is the radical ramifications of quality of life impact. And that includes not only pelvic organ prolapse specifically, but the roll-off of that to vaginal health in general, women's awareness of it, their sense of self-esteem about it, and of course that all intersects with intimate health as well. And all of these QOLs that impact women somehow manage to shuffle their way down to self-esteem level. So if we reflect on the history of women's wellness and look back a little ways into the past regarding how breast health shifted, prior to early 70s when the Coleman Pink Ribbon campaign went large, you could not say the word breast out loud. In casual conversation, on the radio, on TV. You could not put the word breast in print media, whether it was magazines or newspapers. Look where we're at now with the word breast. No one bats an eyelash at the word breast or seeing an image of a breast. That's where we're going with vaginal health, and that's where we need to pay specific attention to help engender that evolution. The circling back to self-esteem is critical. All women in our space pretty much say the same thing in different tone. And how they feel about their bodies is just so devastating to hear. They feel dirty, they feel deformed, they feel just icky in general. And what all of you do not only impacts women's physical health, it radically impacts their emotional health and shores up that self-esteem. So I highly encourage everyone attending this conference to recognize the power that you hold in your hands. But I also encourage you to acknowledge the responsibility that sits on all of your shoulders. We truly need your help. I've been pushing this movement up the mountain for 11 years now. And it's time for white coat, white collar, patients, everyone hand in hand, whether you're healthcare and academic teaching healthcare, research industry, policymaker, any of those sectors. Come together, share your information, but most importantly, talk out loud comfortably about this. It's women's wellness, it's women's health. Nothing more, nothing less. And it's time to remove the stigma that wraps itself around these most pivotal and critical women's health issues. I thank you for your time. I encourage you all to really embrace the conference that you're at. I'm at a conference myself right now in Phoenix, and I'm excited to engage in the process tomorrow. I'm here a little bit early to just scope out the scenery. Know that I have you all in my hearts all day, every day, as much as I hold the patients in my heart all day, every day, because it's going to take all of us as a community together to engender this most significant evolution in women's wellness. Thank you so much for your time. Have a great conference, everyone.